Thank you for coming to this Happy Ombuds Day in our inaugural fiscal year data showcase. And I know it's a small group, so it'll be an intimate Zoom session, which is fine, but I'll just go through my data. Okay, I want to start by talking about the office, and then we'll get into looking into more details of what went on during fiscal year 2020. Just a quick overview. What we, the Office of Ombuds Services, care about is to serve as a no-barrier first stop when visitors are seeking information and insight from a trusted consultant. Our vision is to provide the university community an informal channel of conflict resolution and to obtain access to impartial and honest resolution of problems within the organization. And our value is to assist visitors while maintaining independence, neutrality, and impartiality, confidentiality, and informality. We do have a program evaluation logic model that I'm not expecting that you'll be able to see here, but it is on our website, and I will report a little bit on our program evaluation efforts this year. Our standards of practice, we follow the International Ombudsman Association, or the IOA, Code of Ethics and Standards of Practice, which already was in our values, but independence, neutrality, impartiality, confidentiality, informality. Those are the 4 pillars of how we engage in Ombuds services. So, right into fiscal year 2020 activity. So normally a portion of the ombudsperson's annual report is dedicated to their professional development activities. So just on that end, I attended IOA workshops. This was the first entire fiscal year that I functioned as an ombuds, so there was a lot of training for me to go through, and that turns out to be quite the norm. Ombuds don't come to the job having ombuds training necessarily unless they're moving from one ombuds job to another. So many ombuds actually start their job and then start their training at the same time. I went through all the UT employee required training, and then additionally, I also went through the Tennessee Rule 31 General Civil Mediator training, which is very useful for dispute resolution. My hope is that this year I also am able to go through the family mediator training as well, but with COVID, I'm not sure how that all is going to work out. And when I said earlier that many times ombuds train to become ombuds after their first ombuds job. So the IOA has a certified organizational ombudsman practitioner designation, but that requires that you practice a whole year. So you start your practice, you engage in training for it, and then take an exam, submit your materials. I've passed the exam. They're reviewing my materials, and either I'll get an interview or not. I'm not sure, but in reality at UT, either I will get the certified designation or a candidate designation, and that has to do with how we are complying to federal regulations regarding the Clery Act. So I am not a Title IX mandatory reporter, but I am a Clery CSA, responsible authority, I think. So that might become a problem, and I might not be certified and be a candidate instead. So one of the main things that I do engage in, and I still continue to engage in, is outreach. So we launched the website for the office. The office started May 2019, website launched August 2019, and since then we've engaged, or I've engaged in several meetings, both for faculty and staff, graduate student group meetings, commission meetings, leadership meetings. The graduate school orientation is a big way to get in touch or get the word out to many students at once, but this is the kind of the outreach activity I engage in. If you want me to come to your department, I'm happy to come to your department meetings. I do get called to attend or present in graduate seminars as well. This is the approach for data collection and analysis. In the Ombuds world, there is not necessarily a perfect fit or identified way for collecting data or managing databases. Some people do it by hand. Some people get some like either social work or some kind of, not necessarily medical, but some form of, they can buy into databases that manages client information. I decided for myself that at least the first year, and actually I'm just going to continue doing this, but it was easier for me to capture visitor demographic data just in Excel. And then I also created a qualitative database with QSR and Viva with minimum 1-sentence description of each case with no visitor information. So the key is that I enter it in the database and code everything and you'll see the results later, but activities and what kind of, IOA has a very specific set of codes to use too. So just code everything about a case before I forget. I am not able to keep a record of visitor information or the case itself. So with the number of visitors I have, the traffic I have in my office, there is no way I can remember each case. So I just have to do this as quickly as possible. Data analysis, it's based on conversational narratives, and I look for meaning in the narratives, and I coded data with emerging themes as well as the IOA reporting category themes. So one thing to look at, and these are emerging themes, but why visitors see the ombudsperson at all. So you can see that. So last year, or last fiscal year, there were a total of 257 visitors. Out of them, 227 were really just looking to find a safe space to talk to somebody. And you'll see when you add up 227, 149, 24, that's more than 257. But that's because people come see me for multiple reasons. So one person could come see me for safe space to get more information and engage in dispute resolution. So when people come and when I see that people are coming to see me to find a safe space, what they really are doing is that by talking to me, they can hear their own voice as well. And that really helps people to engage in problem solving and just figuring out, oh, what am I gonna do next? Sometimes I have visitors who just come and talk to me and all I did was truly listen very actively. And they're like, okay, I got it, thank you, bye. And we don't engage in much further conversation. But there are a lot of times when people ask me to go find more information, makes total sense. So in those cases, I'd go to places like HR, the provost office, general counsel, the graduate school, wherever that information is going to be at, I'll go and get more information so then meet with the visitor again so that they can make decisions about what they want to do. And then you'll see that dispute resolution, out of 257 people, there were only 24 people who were interested or who really engaged in dispute resolution. And this is really like sitting with me and both parties and mediating, or in some cases it's me and then I work with them individually and kind of engage in shuttle diplomacy between the two parties. So it's interesting that many times when people think about the ombuds, they assume it's for dispute resolution, but it's really a small portion of what I do. So most visitors came to the office looking for a safe and neutral location to talk to a confidential resource because they wanted their concerns to be heard. So what do visitors do with ombudsperson? So again, this is a thematic analysis. So over time, I started to see some structure of, oh, this is why people are coming. So when they come, at least in fiscal year 2020, there was a trend where people were engaging in situation analysis and then problem solving. And situation analysis was really about, okay, what are the options here? What's going on? So exploring path, both academic and career path. More graduate students doing that, but there are some faculty thinking about, okay, what's my next step in my career? And staff as well. And then there were people engaging in situation assessment where they're thinking about, okay, what's the cost and benefit of doing something, not doing something? And in that process, we also talk about, okay, what do you really, really want? And then once people start engaging in problem solving, it's about generating ideas, really narrowing what the problem is. So that's the problem framing, really articulating it, figuring out, okay, this is the actual problem that now I can grasp and figure out what to do. And then once you get to that point, some people say, you know, that's all I needed now. I'm not going to move on any further. Or some people would then think about, okay, let's think about how to tackle this. And we move into analysis and design solutions. This is the bar graph or frequency chart of what I just talked about. So you'll see that problem solving was 221 occurrences out of 250 visitors. So most people do come with the intent, or at least once they identify the problem, with the intent of, okay, how can I tackle that? And I think I already probably said it before, but I always remind people that taking action or no action, they're both very legitimate options. You always have the option to not do anything, but make sure that that's an sorry, my dogs are barking. That's an empowered choice, and that it is the right thing for you in that moment. So most visitors engage in some form of problem solving related to their situation. And then within problem solving, visitors most frequently engaged in problem framing. So that's the identifying what the problem is. And that makes complete sense, because when I do my outreach, I talk to people about, you can come to me about anything. You can come to me when you feel like, you know, I really don't know what is going on, but I have a gut feeling of it just doesn't sit right. It could be not a problem at all, but it could be a problem. I don't know what's going on. So that's why we work together on, okay, let's look at it. Where is the problem, if there is any? So this is the visitor traffic from July 2019 to June 2020. So like I said, the office started May 2019, which means I was appointed at that point. June, I was creating the charter and also starting to work on the website. July, the website was not launched, but from word of mouth, people were starting to come to me. So that was the lowest month in terms of visitors. But so starting July, there was 8, and then you can see a gradual increase. When we say total visitors, it means that visitors are counted once every month, no matter how frequently they come back to the office within that month. So if somebody comes see me in August, and then they continue to see me like 5 times in August, there's still just one visitor. And this is because of anonymity and confidentiality. There's no way to really track one person. So in the Ombuds world, we just roll to the next month. If the person comes again in September, they're counted as one visitor in September again. But I just wanted to be able to document that, oh, there might be cases where I'm working on on an ongoing basis. So that's why I charted the total cases, total new cases, and ongoing cases. So ongoing case means something that I've been working with a visitor across multiple months. Who came to see the Ombuds person? You'll see, so again, out of 257, faculty was the bulk of with 42.4%, or 109 faculty. Faculty was the most, I guess it was the most type of person who came to see me. Next, staff at 21.8, and then graduate student, the orange part of the donut, at 18.3%. Now, when I say faculty, and I've been wondering if it's because I'm from a faculty background, but I also have to say that many of those faculty came to see me on behalf of their graduate students. They were concerned. They'll come to me and say, I spoke to my student, I advised my student to come see you. I don't know that my student would come see you. So the faculty came to me instead and said, so how can I better help my students? What are the resources I should refer my students to? So there is some part of this faculty, it's really about graduate student concerns rather than faculty concerns. And then there is department head and up group there. And then while I don't technically serve undergraduate students, and people outside of UT, they still come see me sometimes. Undergraduate students, when they do come to me, it's typically related to issues that multiple offices need to kind of get woven in together and work to help a student to graduate or address a financial concern, and there isn't really one office that can work on it, so that I just kind of become the middle person weaving in and out from the offices. Okay, so how often does the ombudsperson work with a visitor? So this is just a chart to give an idea of, so every month, the gray line, just the line, that's the frequency of people who came to see me just once in that month, and the orange is the total visitors that month. And the lighter gray line with shade in, that is the group of people who came to see me multiple times in 1 month. So that's just to kind of show the intensity of visits in an anonymous way. And obviously, the more complex the situation is, people come see me more often in a given month. This is the visitor gender information. So in faculty, staff, and graduate student group, there were considerably more visitors who were women than men. And you'll see it flips at the department head and ups section, but that makes sense because there's more male department heads or people with a higher rank than women. This is the visitor race information, and you can see basically 80% or so are people who identify as being white. And then there is a smaller percentage of all other races, which basically reflects what's in the UT fact book about the general population of the people who work here and who are here. Now you might think, how did you get the race data? It's all based in IRIS, so I have access to IRIS data. So as long as I know the person's name, then I can check it. There are some cases that I can't capture this because there are people I work on, especially on the phone, where I never find their name out too. So then it just goes into the not reported category. I'll move to the thematic analysis unless there are any questions about the data so far. I will take that as a no. Okay. So these are the IOA reporting categories, themes, which means that I did not come up with these themes, but the International Ombudsman Association already have these basically published for ombuds to look for. And in actuality, each of these 9 themes have a lot more specific subcategories as well. But I didn't really, it's not going to be too meaningful to get into all the subcategories, but you'll see that evaluative relationships was the most frequently referenced by visitors. So this would be, a lot of cases, relationships with faculty department head, staff supervisor, graduate student advisor. And issues that can go in there are bullying, conversations regarding their performance reviews, job assignments, a lot of any kind of issues between somebody being evaluated with more power over them. And then the safety, health, and physical environment was the next highest. I categorize anything to do with, and I'll talk about it later as well, but when people say in my environment, either work, my department, in my courses, whatever that is. And it's much more, it's not necessarily about physical safety, but it's their psychological safety of, am I going to be, am I going to feel excluded? Am I going to feel, I'm worried about engaging in conversations with my supervisor or peers. Whatever the situation is, most of the safety concerns were not about physical safety, but about psychological safety, which we go right into. So psychological safety is a shared understanding among work teams that each member is able to engage in interpersonal risk-taking by expressing and being themselves while peers. Okay. And then I kept COVID-19 related themes starting March separately, but just this is ended in the fiscal year. So it's March to June, so it's limited. So out of the 257 visitors, there were 20 visitors who came to see me specifically related to COVID-19. And staff and graduate student visitors were concerned regarding communication about work expectations as well as how remote work will be operationalized. So this is like March, April, May. So people were really concerned about, okay, who is essential? Why am I essential? Why isn't the other person not essential? Why is my lab closing? Why is there, or it's the other way around. Why is my lab not closing, but the other's lab closing? A lot of question about how are these decisions being made. And staff and graduate students were unsure whether department unit level decisions were reflecting what was communicated by upper administration, which I have later, but those are about being compassionate and flexible, students first. And so there were situations where people would come to me that my supervisor's supervisor says, okay, we're going to be flexible. We're going to work this out. We're going to figure out a way to take shifts and as much as possible engage in remote work. But then the supervisor didn't seem to hold to the same spirit or same kind of communication. So a staff member or a graduate student who felt stuck, well, it doesn't seem like I really have a choice. So recommendations in this report, I had 3. 1 was to invest in professional development of university leaders to gain skills to facilitate difficult conversations. Potential training options include crucial conversation skills and nonviolent communication. Recommendation 2, direct the Office of Ombuds Services to reach out to Graduate School Human Resources, the Office of Equity and Diversity, and Office of Title IX in order to develop a joint workshop on difficult conversations for faculty, staff, and graduate students. And I say this because part of the problems that I encountered, yes, a lot would have been taken care, or a lot may have been alleviated. It's not like it's going to go away, but a lot could have been alleviated if leaders knew how to engage in difficult conversation rather than to avoid it or to get a little too critical about it. But also, I think it will empower faculty, staff, and graduate students too to know how they can engage in difficult conversations as well. And then the final recommendation was develop a mechanism to ensure that all levels, new practices, policies, and procedures related to COVID-19 are being implemented in a fashion that is true to the administration's original intent and inclusive spirit. So the principles that the university announced that we're going to follow is community health, student success, and creative, compassionate, and flexible. But other than HR, provost office, and chancellor, I haven't really heard people talk about these principles. So that has been, well, through the report, that has been brought up to the chancellor. So that would be something they'll be working on. Okay, so progress towards program evaluation and recommendations. So for program evaluation, we developed an annual campus visitor survey and partner survey. We decided, my intention was to launch the visitor survey, and it's not like I can track down the visitors who visited the office, so we were planning to send it to everybody, grad student, faculty, and staff, and then people who would respond can respond. But we decided with COVID, April launch would just be too much. So this year we have not done that. But I did send out partner surveys to 30 individuals from people like HR, Title IX, graduate school, provost office, and OED, and received 10 responses. And what they mentioned basically was it was about the outreach efforts, that it's good to have faculty, staff, and graduate students have a place for faculty, staff, and graduate students can have a person to work with, the Ombuds person, to find a path to solution when they find themselves in the middle of a difficult and complex organizational problem. And then updates on the recommendations. So we moved ahead with it. So for things that the Office of Ombuds Services can do. So the Ombuds person is now a certified organizational trainer for crucial conversations. And I am starting to launch that workshop with a pilot group. And then the goal is that we go through the Chancellor's Cabinet, deans and vice provost, and then department heads, and we'll see. We're working with the staff side too to identify how many and who would be the ones. I'm working on that with HR, and we will come up with further implementation plans. We decided to add new service to Office of Ombuds Services to include executive and leadership coaching. And you might ask, why are we pouring more energy into helping leaders when most people who come visit me is faculty, staff, and graduate students? But it's because leaders have so much impact on the faculty, staff, and graduate students. And we think that helping leaders would lead to helping faculty, staff, graduate students more effectively. And my office is in, COVID has slowed a lot of things down, but my office is in the process for reaching out to HR, Office of Title IX, Office of Equity and Diversity, and the graduate school for creating any other programs or training specifically for faculty, staff, and graduate students.